Hi, I'm Dr. Beim, and I wanted to give you a little update about what's going on in Beim Orthodontics at this point. We were expecting to go back to work and start seeing patients again on April 6th. However, last week, the governor of Florida issued a decree that's good for 60 days that dentists and physicians will not see patients except for what they call emergent patients. That is, those that are having emergency type problems, pain, etc. So at this point, we are expecting that that decree expires on May 8th, and we're hoping that all the problems will be behind us and we can start seeing patients in the office again. At the present time, we are seeing only those people that have pokey wire or some other issue that they can't seem to handle at home. And, we can see you in the office for those sort of emergency type things, one at a time, of course, and we will clean up properly, after that. So please be assured that we will do the best to protect your health if you do have to come to our office. The problem is that we don't want to put everybody on hold during this time. We'd like to be able to, continue on with treatment and, in fact, even make progress. And while it may not be that everything we do is in the order that we expected it to be done, we do have our normal order of doing things when we're treating patients. There may be some things we may have to do out of order a little bit in order to get where we want to go, and maybe in the same amount of time that treatment was originally estimated at. So we want to make sure that we're able to continue on with your treatment. We're not going to ignore you. And to that end, I want you to know what we have planned. We knew that one of the future things in orthodontics was going to be, teledentistry or teleorthodontics, just like telemedicine is becoming a big thing. What we didn't expect, and I don't think anybody expected, was it to become necessary so quickly. And so we're going to be doing some rudimentary things. There's some simple things, but there's no real, way to be able to do this simply at this point. And maybe over the next few months, someone will come up with a way. And, we're going to try some things, and we hope that you kind of play along with us. We're going to make it as easy as we can. It'll include taking photos. It'll include probably a little Zoom video, a little discussion about how you're doing, because we really do care how you're doing. We don't want you to disappear for however long this process is going to take. And, there are some things we can make progress on and some things we can't. Like those of you that were planning on getting your braces on, we can't do that right now. And those of you that were expecting to get your braces off, again, we can't do that at this point. And there's a couple of reasons that the governor mentioned in this. The first one being we want to prevent the spread of disease. And the second one, maybe even more importantly, is because the supplies that we use, gloves and masks and such, are needed elsewhere right now. And that's probably one of the main reasons why no one is really allowed to practice at this point. So kind of keep that in mind, that we're working as best we can for you. What we're doing is kind of things from the future, the way things will be later on. We'll be able to do things with braces. We're going to be able to check your aligners if you're in aligner treatment, whether it's Invisalign, Spark, or whatever. And we're even going to contact those that were ready to start their treatment with the aligners. If we have them in stock already, we're going to get you started, on those as well. Please wait for us to text you instead of calling the office. Texting is going to be the best way to get in touch with us. There may not be anybody in the office, but we're available by text all day long. And you just have to, text the office phone number, 407-323-0600, and someone should probably be able to respond to you pretty quickly. If you need rubber bands, text that to us. If you need wax or have a problem, okay, that's great. Send us a photo. We'd like to know exactly what the problem is, whether it's something you can take care of at home or whether we might need to see you in the office. And I think that pretty much answers most of your questions at this point. Stay tuned for additional information that will be sent to you. Some of you already have appointments set up. We're going to see if we can keep those appointments, but virtually. So think of this as virtual visits. And we're even going to be doing virtual consultations for those of you that are thinking about braces or aligner treatment. We may actually be able to get you that information based on the photos and things that you send us. But all of that is in the works, and hopefully we're starting to see patients by April 6th, but not in the office. All right. If you're happy with the fact that we're trying, what we're trying to do, I think it's going to work out very well because we've done it on a once in a while case-by-case basis. Now this is going to be on an everyday, multiple times, type thing. It's going to be a little harder for us to pull off, but we think we can do it. I've got a great team in the office. But if you have a little bit of time and you've been meaning to write that review about how much you love us, go ahead and do that now. Or if you want to, withhold judgment as to how you think this is going to go, that's fine too. But, any suggestions you might have, any questions you might have, anything bothering you, please contact us. We will get back to you as quickly as we can. Thank you and stay healthy.